explain to them, and I will begin. My name's Joanne. I'm going to be your nurse today, and I'm going to check your vital signs and just ask you some basic questions. I'll be touching you throughout the exam.
That is awesome.
I will be using instruments. This will be soft. This will be sharp. This will be another test that I will do. So you will feel things on your body. I'll have you drink some water and I'll palpate you. I will percuss on you. So if at any time you're having any pain or you want me to stop, just raise your hand and I'll be happy to stop and we'll talk about what's going on.
Okay.
So I would like to just talk to you about, do you know who you are and where you are? Do you know today's date and your name and birthday?
Yes, I do.
Tell me.
Okay, today's date is November 4th, and I am Makelia Rogers. My birthday is May 25th, 1989. I'm at the Great Bethune-Cookman University.
Good. And what year is it?
2011.
And I'm going to tell you 3 words, and I would like for you to remember those words and repeat those words, because in 5 minutes, 10 minutes, and 30 minutes, I'll ask you those words again.
Okay.
So, fun,
Fun.
orange,
Orange.
beach.
Beach.
Fun, orange, beach.
Okay.
So I'll just check your blood pressure. You know what your blood pressure is? No? Seriously.
No.
That's a misnomer. That's not good. Now, I'm not going to do the way you guys are taught to do, because time is of the essence. Your blood pressure is 120 over 78. 78's a little high, but I would have thought it would have been much lower for you.
Really?
Yeah.
Just
Because
because
you're
she's
so
skinny?
thin and tall.
Okay.
Yes. So I can go ahead at this point and check your pulse. And your pulse is a little fast. Are you nervous? 78. And her respirations are 14.
You know my respiration?
Yeah, I did that too. Okay, so the next thing I'm going to do is just, actually I guess I'll just have you stand up. Oops, I put that down. And if you could just, let's see, walk over here and knock on that door for me. And turn around. And then if you could walk back to me 1 foot, if you could do this 1 foot in front of the other. Okay, she walks like a princess. Go ahead and just sit back up there for me. I would state that your gait is smooth and steady, and that your tandem walk was intact. Now I would just kind of assess your skin, ask you if you're having any skin problems anywhere.
Little ashy shit.
Skin is warm and dry. Fingertips are kind of cool. Her face is without any lesions or acne or anything like that. Do you have any piercings anywhere?
It's in my ear.
And those are well healed.
I had 6 knee.
Yeah, they look fine. And no tattoos on your body.
I have 2.
And when did you get those?
The first one when I was 15, and the other one when I was 17.
And they're fine. There's no drainage or redness or pain. Going on down the legs and checking the skin for any abnormalities, especially behind the behind the knees and the feet. Making certain that I don't see any abnormal moles or anything like that. Do you use any kind of skin protection when you're in the sun?
Mm-mm.
You have a little scar right there on your ankle.
Yeah.
Doesn't look bad, like it's not giving you any problems. Next, I'm just going to go ahead and touch you. So I say your skin is natural tone and warm and dry. Pushing on your head. You have any pain or problems?
Mm-hmm.
Note that her scalp is mobile. There's no infestations. The color is dark black, jet black. Weave. Okay, and it is weaved. It's pretty. And then I will just come down and I will press on her frontal sinuses and her ethmoid and sphenoid sinuses. Any pain or tenderness? And look at her nares, and there's a few hairs, and I don't see any drainage. And it's moist and pink, and her eyebrows are full and black. Her eyelashes and are also dark. The sclera is white. The conjunctiva is pink. Could you just push on the inner part of your eyes? Like right there? Okay, I don't see any drainage. That cause you any pain or anything? That's good. While I'm here, I'm just going to come on down and ask you to open and close your mouth. There's no clicking, so cranial nerve 5 is intact. I can now just go ahead and push on the tragus and do pre-auricular, post-auricular. Tell me if you're having any tenderness anywhere. And come down the cervical chain, doing light palpations from your head. Just kind of doing deep palpations. Any tenderness? Checking the clavicular nodes while I'm here. And then the submandible, submental. And just swallow for me. And I note the trachea is midline. Her tonsils are not palpable. While I'm also checking the 10 cervical chains, I'm just going to palpate the epitrochlear lymph nodes. Any tenderness? Okay. So those are benign. No infections or anything that you know about. Okay. So I will just now go ahead and kind of look at your, someone could turn off the light for me, your eyes, okay? And it's kind of dark in here, and I'm not going to do anything to hurt you. I just want you to find an object on the ceiling and look at, kind of put your head down a little bit, okay, so I can see your eyes because you're a little higher than me. So I note that the pupils are equal, they're round, the cornea is clear and moist, they constrict, they're consensual. Now if you could look at my nose, and they converge. And if you could just follow my finger. Now, could you turn the, well, wait just a second. I'm going to look in your eyes first with the light off. Sorry. And look back up at that spot. I'm just going to shine this bright, well, maybe you should look at my nose. There you go. Then I can see your pupil. I'm going to shine this bright light in your eyes. So first I find the red light reflex. And I look in, you can go ahead and blink. Look inside, and I see her blood vessels, and there's no hemorrhages or nicks, and the blood vessels are intact. I look for the macula densa, which would be dark, and the optic disc, which would be creamy orange. Your eyes look very good. While I'm here, I'm just going to go ahead and look inside her nose. It's fine. All right, you can turn the lights back on. So, since can you see anything?
Yes.
So if you could cover that, and I would do that on both eyes bilaterally, if you could cover that right eye and just hold this card about 14 inches and read the lowest line.
The lowest one I can read?
Mm-hmm.
Okay, hold on. Okay, my eyes shifting and out of focus. Okay, 4, no, I can read it. 9, 3, 7, 8, 2, 6, W, M, E, X, O, O, 4, 1.
Okay, and I would do that again on the other eye, and note that her optic nerve 2, her optic disc, her Snellen chart reading was 20/25. Do you wear glasses?
Yes.
Okay. While I'm here, I'll just go ahead and look in your ears. won't hurt. I'm just gonna pull on you a little bit. So first I examine the pinna and the tragus and the mastoid process and note there's no drainage or redness. The external canal is intact, and then I place some speculum in the canal. See slight cerumen. Trying to find the tympanic membrane, which would be pearly gray. You have any problems with your ears?
Yes.
What kind of problems?
They just hurt sometimes.
And I'm just going to hold this side and whisper a word.
Okay. Today is Friday.
Okay, and do you remember those 3 words I told you?
Fun, orange beach.
Okay, very good. So now I'm just going to go ahead and test your sensation in your face. So while we're doing the nose and the ears, I'll just have you smell something for me. Can you close your eyes? Cover one nostril. Can you smell anything?
Mm-hmm.
What did you smell?
Alcohol.
And I would do that on the other side as well. So cranial nerve 1 is intact. This is soft and sharp.
Mhm.
Keep your eyes closed. Can you tell me where I'm touching?
My forehead. My cheek. My cheek. My arm. My arm. My foot. My foot.
Sharp or dull?
That was dull. That was sharp. Sharp.
Okay. So sensation is intact. Tell me if you can feel this on your head.
Mm-hmm.
What is it doing?
Vibrating.
And does it vibrate to both ears or just one?
This one over here. Oh, both of them.
You can hear in both ears equally.
Mhm.
So there's no lateralization. Can you feel it here?
Yes.
What is? And tell me when it stops.
Okay. It stopped.
Can you hear anything?
Mhm.
So air conduction is greater than bone conduction, which is what we would expect. Can you feel that?
Yeah.
What does it feel like?
Vibration.
All right. Checking sensation again for vibration on the bony prominences. Can you feel this?
Yeah.
How about that?
Yes. Yes.
All right, very good. Now I'm just going to kind of finish up with your face, and I note that your lips are moist and supple and pink. And if I can get this open, or just in your mouth. So if you could just open your mouth, just open your mouth, smile at me. Okay, her teeth are white and good alignment. I don't see any cavities. And I note her Stinson's ducts are intact. Can you raise your tongue up for me? Look at me. And her Wharton's duct is intact. Now if you say, open your mouth and say, ah. Oh, good. No tonsils. Do you have them removed? So they're not swollen. And the uvula rised on phonation and her hard palate is intact. Can you stick your tongue out for me? Stick it out at me. That's the best you can do? Okay, it's no deviation to the right or the left.
Live.
So that's her cranial nerve 12. Can you just push up on my arms? Very good. Cranial nerve 11 is intact. Push on my hand. And can you rotate your head for me? So she has good range of motion in her cervical neck. And now I'm just going to palpate your thyroid, okay? So I will be pushing on you, okay?
Okay.
And I'll have you put your head down and tilt it a little to the left And I'm gonna have you take a drink, and then when I ask you to swallow, I'll be able to feel your thyroid. So if you can take a sip.